David, my child seems to poo tiny bits several times a day. What is going on with that?
That's usually overflow. So often a child is actually very constipated, and so they've basically got this big ball of poo which is stopping everything coming down, and just little bits are seeping around the side, and often the child doesn't even feel that the poo is coming out. And so people think, well, they can't be constipated because they're actually pooing, but they're not really pooing. This is just a little bit which comes around the side and causes the soiling in their pants, and but they don't feel it. So it's not their fault.
That's the key thing there, is they
Yeah.
don't feel it.
No, they
So
don't
there's
feel
no
it.
punishment for soiling.
No.
So in that case, maybe would it be popping on a nappy until the poo has passed, because the overflow's not going to stop, right? Until
No.
the poo comes out.
So that's where there's sort of steps, and you're treating people according to their sort of symptoms. But in that situation, you would need to sort of disinfect the child, and disinfecting means basically getting rid of the plug of poo, and that can take a little while, and then you go on to your maintenance treatment after that, which, as I said, is going to last at least usually 6 months, but more often much longer.
And what can end up happening with that, Te Maozatu, what can be quite helpful is to know what is a normal bowel motion and what is normal for kids. And that can be quite varied, from 3 or 4 times a day doing a bowel motion to 3 or 4 times a week. But what's not normal or would be considered out of range with these children that only poo once a week as well. But it's for parents and caregivers to know, and that's where the Bristol stool chart comes in. Again, as the different types, checking in with your child when they're independent with their toileting to see if they've been poos. Has it hurt their bottoms at all? Have they had to push really hard to get out? And especially in our job, which helps, is to get parents to do a 2-week bowel diary, because we're all busy and we don't know whether they went the day before or 3 or 4 days ago, and it's not uncommon for us to do a bowel diary with a child and they haven't pooed for 2 weeks, even though they might still be having those little accidents or marks in their undies during the day. But it's also looking for so that type 4, the snake, soft, easy to pass, light brown. Quite often with the overflow or the soiling accidents, it can be quite sticky, really old and dark as well, and really hard for your child to be able to wipe their bottoms themselves, because with that too.
How is constipation linked with wetting?
Well, constipation, when you're really constipated, it actually presses, you've got in the rectum, which is the lower part of the bowel just before the anus, where the poo comes out, it gets very enlarged, and it actually presses on the bladder, and it irritates the bladder, and it also can increase bladder infections as well. But it irritates the bladder, so often children can sometimes start wetting during the day as well, because of this irritated bladder, which then squeezes down and they get a release of urine.
My child's tummy gets really distended and they end up in a lot of pain. How can I help them to feel more comfortable?
Basically, I think it's the most important thing is to really clear the bowels. You can use a bit of paracetamol and hotties and things like that, but that is a real band-aid. We need to help clear the bowels and keep them clear, because one of the problems is people sort of get cleared and then they think, oh, I feel all right now, and they stop their treatment. And that's why you have to have with the whānau to just keep them on a maintenance treatment to allow that bowel which has been really stretched to get its tone back and start working properly, which, like I said, can take months and months.